Hi, so I have Mrs. Smith here. She's a 78-year-old female. She has a medical history of CAD and an MI. She has cardiac stents that were placed, as well as sick sinus syndrome and a subsequent pacemaker. She came in complaining of about 3 days worth of a neuromuscular twitching that she noticed started 3 days ago in her right upper quadrant, and it has since migrated up into her right anterior chest wall. She completely denies all other symptoms: no chest pain, no shortness of breath, no dizziness, no syncopal episodes, to name a few. No upper respiratory symptoms, nothing else. She's denied everything. She says that she's not having any pain with it. It's just this involuntary muscular twitching that she's feeling. She denies any recent history of trauma or illness, any injuries, any change in her medications. Considering her symptoms, I have a couple things I've thought of as differentials. Primarily, knowing that she has the history of the cardiac pacemaker, I am concerned about lead displacement for that pacemaker, especially since it is only one-sided that she's having the symptoms and she's not having pain. I did do an assessment, and in listening to her heart and palpating the neuromuscular twitch at the same time, they don't always line up perfectly, but when the twitch happens, it's always at the same time that I hear her heartbeat. So I am concerned that it's related to a dislodged pacemaker wire. Secondary to that, I have considered some other things like an electrolyte imbalance leading to a neuromuscular twitching. And then also another consideration, though a very loose consideration, would be a phrenic nerve compression. It is something to consider, but considering the presentation of her symptoms being unilateral and not having any respiratory involvement whatsoever, I'm less inclined to believe that would be the cause. All of this considered, though, leaning towards my primary diagnosis of the dislodged pacemaker wires, I do want to get a chest x-ray, and I'll go ahead and get a BMP to check her electrolytes. Leaning towards that diagnosis as well, I would like to better understand some of the risk factors associated with dislodged pacemaker wires. All of this said, is there anything that you would like to add to that list of differentials or considerations? Thank you.